is going to be very positive. So thanks.
Thanks, Judith. And I was just really going to comment. I mean, I think we got very excited when we started to get the joint, when we looked at the performance pack that Dave, I think, and Dave and Jean had been working on, and thought, okay, this is going to be very exciting when we start to use this. I think we touched on including some of the staff survey results within that as well, so that we could benchmark that and look at driving that. Yes, we're looking forward to that proposal, which is next on our agenda as well. So yeah, important conclusion to our discussions there. So thank you. If there are no further comments or questions regarding the JWG report, we then move on to the group board meetings and public paper, which is paper S. Richard, do you want to comment on that?
Thanks, Krishni. Yes, just to say that the board members will be well aware of the development of this proposal, as we had some time in development workshops discussing both ourselves but with colleagues at LPT how we wanted to shape this new development for us as a group. It really, I think, resonates with the approval of a group strategy to have a governance mechanism in place to support oversight and monitoring of it. I think importantly, the proposal to establish a group board meeting is not going to affect the sovereignty of individual organisations. It's really adding an additional mechanism for us to come together and, as Judith was just describing, really to be transparent in public about the work that we're doing as part of our group. So this is very much an outline proposal at this stage, which will inform then the refresh of the supporting governance document, our memorandum of understanding behind the scenes. I'm already working with my counterpart Kate Dyer at LPT on this, which will hopefully, subject to the board's approval today, of course, be brought back then to formalise those arrangements as we launch our group board meetings. As Julia has already helpfully trailed, within the paper is also the proposal that we essentially disestablish the joint working group, which has served us well hitherto, but would then be supplanted by the role of the group board meetings in the future. And to avoid any loose ends, we'll therefore be behind the scenes transferring across any ongoing pieces of work on the JWG's forward plan to the relevant plan, either of the group board meetings themselves or to individual programme or trust meetings. So in essence, I'm seeking really approval from the board on those two areas. One is the outline proposition for the establishment of a group board meeting with LPT, and the other is the disestablishment of the JWG. Happy to take any questions on the proposal as well. Thank you.
Thank you, Richard. So any questions? I think this was trailed at a recent joint board development workshop where we talk through some of the sort of principles. As Richard says, the detail just needs to be worked through into a further proposal, but at this stage very much just really looking for formal board support to take that forward. Angela, please.
Yeah, no, thank you. And like others have said, welcome the next stage, if you like, in terms of this journey that we're on across the group. But I think also just to say that, and David's put in the chat about the reminder about the story, because not everybody's been on the journey for forever. That's really important. But I think importantly, during that period of time, we've seen more groups emerge. And I think that is something that we recognise, and certainly has been more of a feature in the architecture across the NHS, more shared roles, etc. And I think equally, just reflecting back to the early discussions around changes in the NHS, I think groups, collaboratives represent an ideal and unique opportunity to take some of the work forward and to really think about its role and our roles in that as integrated care boards become, if you like, different and clearly up for progression and transformation. Thanks, Krishni.
Thanks, Angela. Julia?
Thanks, Krishni. Yes, just to say that I think the opportunity for some of the committees perhaps to do some work, I know that's part of the proposal. I meet with the my opposite number over at LPT regularly, and I know the other chairs have contact with their opposite numbers. And I think it's going to be really, really important going forward, because then we can have discussions once, and more heads around common problems will be much easier to solve things, I think, and share risks and how we're managing things. So really look forward to that, but absolutely welcome the proposal. Thanks.
Thanks, Julia, and certainly I think it's really important that the vehicle that we, the way in which we want to use this sort of will, as Richard clearly said, still recognise the sovereignty of the individual organisation, but bring us together to address those sort of common issues. And I think we touched on the idea that it's very much sort of boards in common, whatever the language, the technical language will be, but it will be both boards in the room together discussing issues that we agree are helpful to work on together. And then there will be other things that we do need to take forward as individual boards. So it's the flexibility of that opportunity, and particularly, as Judith said, I think transparency to members of the public around the discussions we're having together as two organisations, and then the opportunity for further learning and improvement, which is really ultimately what drives this, but doing it in a public setting, I think is really helpful. So I would just want to ask for the board's endorsement of the proposed approach, notwithstanding the further work that needs to be done, but also to approve the disestablishment of the joint working group, thanking colleagues who've supported that, and all the work that's been done to take that forward. But it does feel genuinely like this is the next phase, and a very exciting one. So I'll take it that everyone's happy to approve that. Great, thank you very much. So we have our final item of the governance and assurance section of the agenda, and that's the board development programme. So back to you, Richard.
Thanks, Krishni. Yes, this is very much a living document, in the sense that we, with our board development programme, we aim to be responsive to emergent opportunities to learn and develop. So board members will recognise much of the content of this report as it sort of builds on content that's been received previously. Notwithstanding that, I guess the point in the report in particular to draw out is the proposal for the 25-26 year. Building on the conversation that we were just having about the establishment of a group board, you'll see that we've got opportunities both for us as an individual organisation and as a group to come together in leadership and governance topics over the coming year. We've set out what we know at the moment, which largely relates to the NHFT board programme. As you can see in the report, now that we've approved the progression into a group board context, we'll then start to articulate more clearly the proposal for the group development workshops. We are incidentally harvesting ideas from committees and also taking the opportunity to do things in common where it makes sense to do so. So, for example, in the April session, we're likely to do some training that's common to both boards, as we know that that's often beneficial to learn from others' experience across the group. So really at this stage, it's to give you a sense of what we've got in plan for 25-26, and indeed to take any feedback or suggestions on what we might want to add into the plan as we go forward. So happy to take any questions on the report. Back to you, Krishni. Thank you.
Thank you, Jo.
I think one of the opportunities, Richard, particularly in that joint context, maybe something around the 3 shifts. And how we're responding. And I know it's something that Dave and his colleagues have been talking about a lot with us, but maybe something across the 2 trusts would be particularly opportune, and where we can build in something about approach to waiting list management, because I think, again, it's going to be something that that the government are going to be pushing hard on. And again, if there's best practice that could be shared or other opportunities, I think those would be both useful for board level conversations.
And that's a suggestion, Jo, for joint board conversations on those areas. Yeah, thank you. Yeah, really helpful. Thank you. Any other suggestions? It's important. I mean, obviously, this is a very flexible document. It's not set in stone, but it gives a sense of what needs to be covered. And I've certainly fed back to both Kate and Richard that I'd like a degree of without sort of forcing it to be exactly the same, because that there's no need for us to do that. Certainly some commonality. So because there'll be topics that we as boards need to cover, that the content will be different because it's specific to us, but the need to cover it is still the need to cover it. So I've certainly asked Kate and Richard just to work on that. A couple of points that I wanted to mention, one on just freedom to speak up. Richard, I think that we will need a session, I think, with the Guardian, and I'm not sure that that's included in that, but normally that would be something we'd want to do. And also, I think we need to have medium-term financial planning on our radar, because I think it is, you know, that sense of this is an ongoing process rather than an annual waiting for NHSE guidance process on what the future looks like. I don't know, Paul, you think that's reasonable, but I do think a regular conversation on that sort of at that kind of level might be helpful.
I certainly think that given the planning round, Christy, that's to be honest, essential. I think conversations over the last few days echoing your points around the fact that this isn't just a one-off, and actually some of the challenges that we've got, it may be that as we're putting processes in place, that we embrace them earlier, you know, and get on with it, because that helps for that helps for 26, 27 and beyond as well. So I think it does need to be a regular feature. I think the updates that we'll bring on the back once we've got the 25, 26 plan nailed down, we'll be able to do that very quickly. And I think that the earliest opportunity the board can have to discuss that, I think, will be an important factor about how we plan our way through.
Thanks, Paul. Melanie?
Yes, I think this may fall into the category slightly that Joe's already covered, or maybe even just into the flexibility that you referred to in terms of items that might crop up across the course of the year. But it strikes me that with the changes to NHS England, the changes potentially with ICBs, we certainly probably need to have a placeholder in the board development workshop that's about environmental change, maybe, and sort of new structures, frameworks, requirements. And the other thing that I wonder whether we should try and structure in some time is to really bring the board together, and this might be a joint or individual, about neighbourhoods. And this might come into Joe's comment about the shift to community, but I don't think we necessarily as a board sometimes think enough about the sort of the opportunities that neighbourhoods provide us and how they are evolving and emerging in Leicestershire, although we do touch on it in various different contexts. And with that, I also wondered whether, alongside having development workshops that are in partnership with LPT, there may be other organisations that we might want to engage with in a development setting. And again, as the environment evolves over the forthcoming year, maybe trying to get some time with the ICB, maybe trying to get some time including a wider range of stakeholders might also be helpful, rather than always being just sort of with ourselves as the audience.
Thank you, Melanie. I mean, yeah, I absolutely support any opportunities, I think, to get together with system partners. Always more challenging to organise, and obviously reliant on partners wanting to engage similarly. And I think it depends also what sort of collaborative arrangements might exist as well. You know, for example, I mean, this doesn't particularly apply in Northamptonshire at the moment, but we have a UEC collaborative in LLR, which does include NED representation and exec representation. So there are different vehicles for some of that, aren't there, that we might want to think about and encourage. And that may well be one of the things that emerge out of the new landscape, is because I think collaboratives will still be very much a part of that. But yes, we should keep our opportunities. I've certainly emphasised the importance, I think, of NEDs coming together, supported by relevant execs engaging as well within across the system, because I think, and I've encouraged the same in LLR, where it doesn't currently happen quite in the same way as it does in Northamptonshire. So those things I think we need to take advantage of. But I specifically on the topic, Richard, around the emerging landscape, I think is one that we'll probably need to cover across the group, really, because it's probably a common message, isn't it? But that is going to be something we're going to need to be cited on and have opportunities to discuss. What does that mean? And unpick it, really, because there's a lot to understand about that, I think. Julia?
Thanks, Richie. I suppose it builds on from that. My point was around, we had a very, very good session last year with LPT from our CQC colleagues. So it builds in just to the environmental changes and things that are emerging. But that would be a really useful session as their processes change and personnel change, etc. And I know the Trust has a really strong relationship with our CQC colleagues and meets regularly with them. But actually for us as a wider board, that would be very helpful, I think, to build that in future plans.
Yep. Thank you, Julia. Yeah, good point. Duncan?
Yeah, my point goes back to the medium-term financial plan and the free shifts point. And the thing that I see the opportunity of is perhaps looking at the proximity of those two debates, and in particular with reference to the BAF and the way that in the past we've not seen our BAF scores move sufficiently, which we've debated elsewhere. The opportunity, perhaps, Paul, to take a look at business cases that are coming out at the moment in light of those free shifts and set an impact assessment of how they're going to be impacting on that medium-term financial plan. So forgive me, three strands all coming together. It strikes me that there's an opportunity there to start pulling those thoughts together in one setting.
Okay, Duncan, thank you. Anne?
Yeah, I just wanted to come in on the neighbourhoods part that Melanie was mentioning earlier. I think as we're progressing as a system into more of a collaborative space with neighbourhoods around primary and community partnerships and same-day access approaches in primary care, this is going to be really important. And as we just structure those meetings, just considering what the makeup of that should be, we will have exec leads in there. It's whether the format gives for bringing a wider audience, and I think we should keep close to that and see, then we could bring that into any of our development work that we're doing in NHFT as well.
Okay, thank you everybody. Richard, have you been able to capture some of those thoughts, and are you comfortable that you can reflect that? So I think that just
Indeed.
broadly, it's sort of there's some things there around environmental changes in our environment which might impact on us, and making sure we understand those collectively. I think that includes the three shifts and the long-term plan when it's published, and what those things mean. Irrespective of all of that, I think the sort of sense of the medium-term plan and how we drive value continuously rather than as a sort of annual process. We've talked about CQC and Freedom Speak Up as well. So some specific areas and some broader areas that are more about the general context. But it is something we can, obviously the board at any point can really agree that it's something that is a topic that we need to cover in one of our development sessions, and that flexibility will always be there for us to do that. But it's always good to identify things that we'll want to talk about as we go through. So thank you very much for contributions on that, and just note that is the plan at the moment. agree that we'll add the additional things that have been highlighted and continue to evolve the plan over the coming year. So thanks very much. Right, well, I think we're now at the end of our sort of main items of business. We do have the register of interest available for public scrutiny as paper U, and it's just there for us to note. Just a reminder also that I think our the request to update that has been sent to every member of the board. I think the deadline for it is today, if I remember correctly. So if you haven't already completed that, there is a link for us to update our declarations of interest alongside a fit and proper persons return, which I think has been issued for us to complete. I don't think I've got any other business other than to note again that this is Chris's last meeting and thank him again, as we've already recognised through the course of the discussions. And then finally, any other points regarding the effectiveness of the meeting today? I think the timings feel very appropriate because we've landed there or thereabouts, which is helpful. But is there anything that colleagues feel we should have covered that we haven't? Or any amendments or reflections in relation to the risk register or communications points that people would like to highlight? So any feedback on the meeting? No, quite content about the meeting as a whole. Okay, well, thanks everybody for contributions today, and thank you to anyone who's watching this meeting back and engaging with the content. And I will close the meeting there. The date of our next meeting is the 29th of May at 9:30, the date of our next public meeting, and we will therefore close this meeting, and board members, if I could ask board members to be back for our private meeting at 1:30 as planned. Thanks very much, everybody.
Thank you.
Thank you. Bye-bye.
Thank you. Bye-bye.